Greetings from Indian Journal of Anaesthesia. I, Dr. Riniki Sharma, will be presenting a narrative review published in the January 2025 issue of Indian Journal of Anaesthesia. It is titled Critical Appraisal of Systematic Review and Meta-analyses. Systematic review and meta-analysis of randomized trials are the highest level of evidence, systematically summarizing research with predefined protocols. Advances in tools and databases have increased a systematic review and meta-analysis, but critical appraisal is essential to interpret them correctly. Without appraisal skills, flawed conclusions may impact clinical decisions and outcomes. The SRMA's validity depends on the study quality and subjective methodological choices that can influence results. This reviews outlines the skills required for critical appraisal of a systematic review and meta-analysis. So the critical appraisal framework starts right from the research question. The research question must be explicitly stated, typically using formats like PICO or PEU for focus and precision. The key considerations while doing a critical appraisal should be if the question is clear and well defined, does the review's purpose align with its objectives, and does it offer novel insights or merely replicate past studies? An unclear question leads to a directionless and inconclusive review. The inclusion criteria must align with the research question and be clearly defined to ensure the reviewer's credibility and relevance. The key questions should be, does the criteria match the objectives? Are the included studies relevant and consistent in terms of population and outcomes? And does this review avoid bias from heterogeneous populations affecting the effect sizes? A strong search strategy minimizes bias and should be comprehensive and tailored to the research question. Here, the key questions while doing a critical appraisal should be, are all relevant keywords and combinations included? Are excessive restrictions like language limits avoided? And is the database selection comprehensive? And gray literature and clinical registries trials are included or not? Because a poorly executed search strategy can bias results by missing critical studies and or including irrelevant ones. Coming to the bias assessment that evaluates bias in individual studies, which is crucial for SRMA validity and should use validated tools. Here we should ask questions like if the tools used are like the Cochrane risk of bias tools or Newcastle Ottawa scale used appropriately. Is the choice of the tool justified by the study design? Are methods and criteria for bias assessment transparent and up to date? Bias assessment should involve at least two independent reviewers with discrepancies resolved through consensus or through a third reviewer. While looking for data extraction is important because accurate data extraction ensures the review's validity. The key points that should be kept in mind while doing a critical appraisal is the data extraction done independently by two reviewers and tools or software piloted and described in the review, because piloting tools enhances the review's robustness. Data synthesis and heterogeneity should be scientifically justified. Here, statistical methods used to address heterogeneity should be adequately critically appraised. Are the heterogeneities explained with subgroup or sensitivity analysis, or is narrative synthesis used when meta-analysis isn't suitable? For publication bias, which occurs when studies with positive results are more likely to be published, distorting the evidence, the key points that should be asked are funnel points or tests like Edgar's test used to assess the bias? And does the review meet the minimum threshold of 10 studies to detect the bias? Does the search strategy reduce the risk of bias? Coming to critical appraisal of a trial sequential analysis, which is an advanced statistical method used in systematic review and meta-analysis to address biases from cumulative interim analysis and determine if more studies are needed. Key questions should be whether the rationale for TSA is clear. Is there concern about previous studies overestimated effects or inconsistencies? Does the manuscript explain the required information size assumptions, including effect size estimates and error thresholds? For the TSA results, are the adjusted confidence intervals and boundaries for significance, futility presented? And does the manuscript highlight clinical relevance, not just statistical significance? For heterogeneity, TSA should account for heterogeneity in its calculations. The conclusion based on TSA, does the manuscript show if sufficient required information size was achieved and if futility or significance boundaries were crossed? In results and conclusions, the results should logically align with conclusions, ensuring relevance to clinical matters. The key question should be, are the conclusions supported by data analysis? Does the discussion address evidence and relevance? Are tools like grade used to assess the recommendation? To identify the knowledge reviews often expose literature gaps to guide the future research. Here, one should see if limitations like sample size, heterogeneity, or imprecision are discussed, and any specific research gap identified for future studies. Thus, systematic review and meta-analysis are powerful tools, but require rigorous appraisal to ensure their validity. By systematically evaluating the research question, inclusion criteria, search strategy, and analytical methods, practitioners can discern the reliability of an systematic review and meta-analysis. Thank you.